Another great Tuesday, and we're looking forward to another incredible 30 minutes. We're in for a special treat today. I'm in Irvine, California at Keating Dental Arts, full-service dental lab. As most of you know, I am the Director of Clinical Education and Technology here at Keating. Well, today's going to be a really fun time. We've got Damien McDonald, the president of Kerr, the dentists and clinicians that are listening. I mean, we've known about Kerr forever. Initially you think Herculite. Although it's...
I'm glad you think Herculite.
Absolutely we do. Absolutely we do. That's been a kind of a mainstay. That was the golden standard for so many years, and now Herculite Ultra is back on top. But it's much more than that. Kerr is much more than Herculite and Optibon. It's a huge entity. To give you a little bit about his background, he's from Sydney, Australia. He now lives in Orange County in San Juan Capistrano.
That's
where you're living now. Yeah. So for those that haven't met him, the women in the audience are going to listen to his voice and say, I want to meet him. And all the men are going to say, how come I can't sound like him? You've got that charming debonair voice, and it's so much fun. We've known each other about 3 years now.
That's right.
I've had the pleasure of having a glass of wine and eating at your home, and we've had dinner together, and you've sat in my dental chair.
I've had many hours in your dental chair, and very grateful for the care.
Thank you. So it's been a great patient. So, it's... a lot of people don't know that the Kerr that a lot of us that have been in practice 20 plus years, it was a small little composite company, is part of this huge umbrella, Danaher.
That's right. Yeah.
And you came from that side, Danaher.
That's right. Yeah.
Okay.
So Danaher made a very conscious decision to get into businesses where science and technology, made a difference. And about 04, 05, started getting in with the science of Gendex and Cavo, and so equipment. And then in 07, bought the Cyberon family of companies, and integrated the two sides of equipment and consumables. And so really the journey for Danaher has been about trying to get deeper into the science of the patient care of dentistry. Most recently with the acquisition of Nobel Biocare, which is tremendously...
Oh, wow, it's huge.
Yeah, tremendously exciting for us. So the family of companies now, we think, and we've got some pretty good data, we think that we're in 99% of dental practitioners' offices globally. There's some part of our family of companies is in 99% of practitioners' offices. And that gives us tremendous insight. And I think what people are going to see from us over the next 5 to 10 years, that insight is going to really pay off in terms of the things that we develop, the innovations we bring to the market, because we can see the entire workflow. In fact, all the discussions we're having now as a family of executives is about the workflow. How is it that we make a difference, whatever you're doing, general practitioner, endodontist, a general practitioner and who's doing endodontics.
Right.
How is it that we help you with the workflow? Similarly with implants, there's a lot of case studies and planning that you need to understand. How is it we can make that easier?
Okay. Which makes sense. Typically it's always been isolated. I don't do endo, I don't do ortho in my practice. So I'd never had any interaction with those companies at all. I don't know the reps, I don't even know the names of the companies. And now you've got, under that Danaher umbrella, you have your ortho company, which would be...
Ormco.
Ormco, which everyone's heard of, but people like me have never worked with them. And then the endo side is...
There's a group, it was called Cyberon Endo.
Oh, okay, that's right.
But the Axis, which made all the burrs, and but I think this is the interesting thing you're talking about. This dynamic. What we're seeing is the general practitioners are saying, well, hang on a second. If I'm really going to take care of the patient, how is it that I can be more integrated into all their treatment? And